Hello, everybody. It's another episode of Clot Conversations. I'm David Airdrie from Thrombosis Canada, and I'm here with Jamil Abdurrahman and Dr. Lana Castellucci. Dr. Castellucci is an associate professor in the Faculty of Medicine at the University of Ottawa and a scientist at the Ottawa Hospital Research Institute. We're coming to you from the 2025 ISTH from Washington, D.C., and it's great to have our guest here today.
Thank you for joining us today. So could you tell us a bit about your study, the COBRA study?
Thanks for having me. So the COBRA trial was a comparison of rivaroxaban and apixaban for bleeding risk in patients with acute VTE. And so each patient was treated for 3 months, followed in the study for 3 months using standard dosing of those anticoagulants. And we aimed to evaluate a combined bleeding endpoint of major bleeding and clinically relevant non-major bleeding based on the ISTH definitions.
All right, that sounds interesting. And what did you guys find?
So we found that apixaban had a much lower combined bleeding event rate compared to rivaroxaban. And this is really practice-changing information. And we've already heard some great feedback from people here at the Congress that this has changed their order sets and is likely going to change how they prescribe anticoagulants for patients with acute VTE.
From what I remember, that was decrease in both major bleeding and decrease in clinically relevant non-major bleeding and no difference in VT recurrence. Is that right?
Yes, that's correct. So certainly we were not powered to have the individual outcomes of major bleeding and clinically relevant non-major bleeding, nor recurrent VTE, but reassuring data that it all aligned with, as you said.
Great. So going forth, how would this change your practice? Do you think with acute VTE, you're only going to prescribe apixaban? Is there patients where you might think of prescribing rivaroxaban?
Yeah, it's a great question, and we don't have all of the data just yet, so we're still in the process of analyzing some of that information. And so I think for most patients where you're going to use a direct oral anticoagulant for acute VTE, apixaban will likely be the choice anticoagulant to use, but there may be some patients where another direct oral anticoagulant, rivaroxaban or other, might be appropriate for that patient, and I think it will be a combination of their patient characteristics as well as their preferences.
And any thoughts on why you think there was this difference in bleeding risk?
Yeah, thank you. So another great question. And we haven't had an opportunity to analyze the bleeding events yet and the sites of bleeding that were identified. And so that will come with our secondary analyses. What we saw from the original analysis is that the curves separate early. So it may have something to do with the higher intensity period of rivaroxaban dosing for a longer period of time.
Interesting. And then also, so this looks specifically acute VT treatment, that first 3 months. Would that affect our thought process anything with secondary prevention, right? We don't know secondary prevention, reduced dose of rivaroxaban versus apixaban in terms of that bleeding risk. Any thoughts in that area?
Yeah, thank you. So great question. So we do have some information published earlier this year, late last year, from the Renove study from the group out of France. And so that's another opportunity to reassess what your patient risk is and decide on reduced dose versus full dose as to whether or not they would benefit from either one of those.
In terms of reduced dose of rivaroxaban versus apixaban, any thoughts there?
Yeah, so the Renove study was helpful in guiding that. I don't think we can expand on COBRA from that perspective. We really only looked at the 3 months. And so any further information for secondary prevention, we'd have to go to those other studies.
Perfect. Thanks so much. Is there anything else you want to add?
No, thank you for the opportunity to be here.
Thanks so much for joining us today.
Thank you both for this great interview. I appreciate it, and I'm sure our listeners appreciate it. This has been another episode of Clot Conversations from the ISTH 2025 in Washington, D.C. Don't forget to check out our website at thrombosiscanada.ca and look at the notes for future links to publications related to this study. And thank you for listening. Take care.